To begin, I'm going to discuss some background information concerning cleft lip and palate before conducting an interview focusing on the lived experiences of individuals with cleft lip and palate and their families. A cleft can be described as a separation or division into two. It is during the early stages of prenatal development that various areas of the baby's mouth and face form individually and later connect together to form the roof of the mouth. Some parts fail to come together properly, resulting in a cleft. Cleft conditions vary in severity and extent. It is possible for a baby to be born with only a cleft lip, only a cleft palate, or both cleft lip and palate. It can be incomplete or complete and may occur unilaterally or bilaterally. The term cleft palate speech is used to describe, in some circumstances, abnormal nasal tone, abnormal nasal airflow, and nasal or facial expressions. Children with the birth defect, cleft lip and palate experience trouble with feeding, speaking, hearing, and problems with their teeth. Breastfeeding is difficult because the baby cannot perform proper suction. Specialized bottles and techniques are used to sustain the baby's nutrition. Due to a smaller jaw in patients with cleft palate, difficulty breathing is also a concern. A delay in the development of comprehension and production of language in children with cleft lip and palate is apparent. Cleft lip and palate is a disorder that arises in about 1.7 per 1,000 babies with varying ethnicity and geography. 1 in every 600 to 800 babies is affected by cleft lip or cleft palate. Cleft lip and palate is more common amongst Asian and Latinos, where 1 in 600 are affected, and 1 in 1,000 Caucasians, whilst 1 in 2,000 African Americans are faced with the defect. Today we will be comparing and contrasting the lived experiences of individuals with cleft lip and or palate in different circumstances. Pinky is a 5-year-old girl living in rural India with a unilateral complete cleft lip that was treated late due to lack of funding. Danielle is a baby born in Seattle, America, who began treatment for her asymmetrical complete bilateral cleft lip and palate soon after birth. The interview will be conducted with Danielle's mother and Pinky's father, translated to English with the inclusion of meaning. I'll now commence the interview. How do you feel about your child's cleft lip and or palate before and after they were born?
Before Pinky was born, there was no way to tell if she would be born with a cleft lip. When she was born, we were shocked and felt terrible that she had to be born like that. I wondered, what if it stays like this? How will she ever get married? In our village, it was not accepted to have such a deformity, and she was shunned by society, limiting her involvement in social activities and opportunities.
Before Danielle was born, I received a call from my doctor. He told my husband Dale and I that they'd found something on our baby's ultrasound. We soon found out that our baby girl was going to be born with 2 birth defects, a cleft lip and a cleft palate. I felt sick, angry, and sleep deprived. After the initial shock had set in, we were reassured that we were giving birth to a healthy baby. It was reassuring to know that today's technology will dramatically benefit Danielle's future.
How has technology played a role in your child's journey?
Throughout Pinky's treatment journey, we did not have a huge involvement with technology. The only form of technology we encountered was the phone used after Pinky's operation to call home to the village to inform them that Pinky's operation had been successful.
It is so reassuring with today's technology. We have access to all types of healthcare workers in the United States who work together to ensure the best outcome for children like Danielle. We had access to technology which could monitor her growth and heart rate before birth. After she was born, we had various types of feeding bottles to ensure she was receiving nutrients and medications to help her grow. At 4 months of age, Danielle was given a nasoalveolar mold. Nasoalveolar molding is used as a non-surgical procedure to reduce the cleft inside the mouth, reduce the gap in the upper lip, and narrow the nose prior to surgery. This decreased the number of surgeries required for Danielle.
What do you believe caused your child's cleft lip and or palate?
It was caused by the eclipse that occurred while she was in the womb. It was God's will.
We understand this is a medical condition. We were told that a cleft occurs somewhere in the 7th week of pregnancy and is normally caused by chromosomal problems or genetics. With no history of cleft lip or palate in our family, the doctors advised us that this was just something that occurred as she grew. No cause, no meaning, but just because that's what God wanted.
Did you think it would affect your child's life?
I did think it would have an effect, but not to the extent that it did. She was socially excluded and was unable to attend school because of it, depriving her of an education. The children her age would also taunt her, calling her cut lip. I didn't think my daughter would be able to find a good husband either. I was worried about Pinky having a bad life.
Despite the initial fear and anger, I realised how incredible it was to be reinforced that the only thing wrong with my daughter is something cosmetic and slightly functional, and it will most likely not impact her life in a powerful way. Even before Danielle was born, I was constantly reassured by today's technology.
Financially, how did you feel about the operation?
I was so relieved when they offered the free treatment. Without it, Pinky would never have been able to get treatment. However, it was difficult to arrange travel to the hospital as we didn't have a car nor the money to afford the travel. Fortunately, we were able to arrange transport for Pinky to get to the operation. When we realised how important this procedure was, we were even prepared to walk to the hospital, which was around 3 hours away.
We discussed our insurance with our social worker, and from the beginning we were so grateful that our private health insurance company, Group Health, would be very cooperative and help cover a majority of our treatments. It took some work, but we were also able to cover 80% of bottle costs, receiving 4 new feeding bottles each month. Future dental costs are also covered by our insurance, which is very reassuring for Danielle's future. Danielle's father also received pay for time off work.
How easily could you access treatment or guidance?
As I said earlier, without the treatment being offered directly to us, we wouldn't have known anything about it. The social worker was very helpful in telling us everything we needed to know about Pinky's treatment. However, the hospital where the operation was to take place was very far away.
We had access to treatment and guidance for the entire journey. From prenatal up until this day, we still continue to have appointments and checkups to ensure that Danielle is developing and healthy in all aspects of life. We are so grateful that Danielle is not experiencing any delays socially, physically, or mentally.
Are you aware of any side effects from the surgery?
There were no side effects from the surgery. She was in the hospital for 7 days to ensure that she was in full health before returning to our village. We also had to keep her quiet and inside for 10 days afterwards.
At age 4, Danielle began to visit a speech pathologist to ensure that she had no air passing through her palate or coming out of her nose during speech. She had atypical tongue placement and a few sound distortions, where she would add or subtract some sounds to words. Her hearing has also been affected by her cleft lip and palate, with hearing loss in both ears due to the fluid buildup behind her eardrums. This resulted in an inability to hear normal speech.
After the operation, how do you feel your child's life has improved?
Pinky's life has improved immensely. She is now attending the local school, has many friends, and is no longer taunted by her peers. She will have so many more opportunities to become someone special because of this procedure. We are so grateful for the treatment and how it has bettered her life. Now she has a better chance of getting married.
The surgery Danielle received has meant that she's able to eat and drink, just like every other child, and participate in everyday activities. Danielle is now attending kindergarten. She has good hearing and is exceeding the number of words appropriate for her age. This was really reassuring to know that Danielle would fit in at the same level as other children in her class. She continues to have checkups with her doctor, dentist, and school speech pathologist to ensure things are on track. Furthermore, Danielle participates in typical American childhood activities.
To summarise, the similarities between Pinky and Danielle include type of cleft, family's distress, religious beliefs, i.e. God, successful surgery, and the want to improve their child's quality of life. The differences include financial factors, access to healthcare, age of the operation, education levels of parents, and cultural beliefs. The significance of these children's lived experiences shows the importance of economic factors, location, and education in the provision of treatment for a cleft lip or palate, thereby affecting the child's quality of life and their ability to participate as a productive member of society. If Pinky had not received her operation, she would have experienced continued social isolation and developed issues with her speech. This would thereby affect her ability to obtain education and gain employment later in life.